once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As we continue our conversations around the COVID-19 pandemic, I want to encourage you to send your questions and comments by WhatsApp to 620-6275 or email docandcovid@gmail.com. I am wearing my mask right now, covering both my nose and mouth, but I'll take it off because no one else is close to me right now, so I'm not putting anyone at risk, and no one is close enough to me to put me at risk. Remember, we say that the distance we need to keep between persons is a minimum of 6 feet. We need to continue wearing our mask, and we need to sanitize as often as possible. Now, before I came here today to record, I was having a conversation with one of my online friends, and he had some particular questions about the COVID-19 vaccine. As we speak now, we have vaccinated over 50,000 of our citizens, and that is a remarkable achievement from the time we started to now. And it is great to know that we actually have the resources or the vaccines available to continue this program. We are aiming for over 100,000 of our citizens to be vaccinated by the end of April, and that would be a remarkable achievement, taking us to the top of the pile in the CARICOM group of countries. So my friend was asking me very important questions. Why should we take the vaccine? What do we need to do after the vaccine? Do we need to actually continue to wear masks and social distance and sanitizing? So I want to address those two questions very clearly. Why do we need to take the vaccine? Well, the vaccines, all of the vaccines, regardless of which one you take, whether it's the AstraZeneca, the Sputnik, whether it's the Sinopharm, those are the three that are available in Guyana, and the others that are not yet here, Pfizer, Moderna, or Johnson & Johnson. All of these vaccines have been shown to be 100% effective in preventing severe COVID infection and preventing death from COVID infection. And that's a very important thing to achieve. If you can use something that makes the infection only mild or moderate and keep you out of an ICU and keep you from dying, that's a worthwhile thing to do. The second part of the conversation that I had with my friend was, should we continue to wear masks, social distance, and sanitize? And the answer, the simple answer, is yes. How long we need to do that, I'm not quite sure. The pandemic has not been around long enough for us to know these answers. But I suspect that once we have enough persons vaccinated, then the spread of the infection will be much, much less among vaccinated people. And there is enough evidence and credible research that has shown this, that persons who have received their vaccines, even in one single dose, they have a less incidence of carrying around the COVID-19 virus. So that is an important thing to know. We don't know how long the immunity would last for after you get your vaccine. We've just started doing this. It hasn't been a year yet. We don't know if people will need to take the COVID-19 vaccine yearly, twice a year, once every 5 years. We don't know. So we are learning about it. We can only base our recommendations on the knowledge that we have had so far and the scientific models that are built around the known evidence that is out there. The main thing that people are concerned about right now is blood clots in vaccinated people. And again, I want to be very clear and very specific about this, that the incidence of blood clots in the general population is far more than the incidence of blood clots in the vaccinated population. Let's take Guyana, for example. Let's assume we have 1 million people here. We expect, just on statistics, that there will be 500 to 800 people a year who develop significant blood clots. That is without COVID vaccines. That's the general population. If we look at the evidence for blood clots in vaccinated people, if you have 10 million people vaccinated, you expect 40 blood clots. So let's say if Guyana has 1 million people, you would expect 4 blood clots, way below the 500 to 800 persons that you expect in the general population with or without COVID vaccine. The main problem with having blood clots, for example, in the legs, is that it can break off and travel up to the lungs and cause something called pulmonary embolism, or PE. Pulmonary embolism is a major contributory factor to death. About 7 to 9%, almost 10% of people die from pulmonary embolism based on autopsy reports that are done on people who died. In the United States, these represent about 650,000 cases of pulmonary embolisms occurring every year. That's 650,000 cases. And they account for 150,000 to 200,000 deaths per year in the US. It is the most common preventable cause of hospital-related death, and it is the third most common acute cardiovascular cause of death. The number 1 and 2 being, of course, heart attacks and stroke. All right? So just to highlight the fact that blood clots in the general population far exceed the number of blood clots that we have recognized so far in the vaccinated population. So the fear of blood clots is perhaps something we need to look at again, recognizing that it can occur much more often in a general population, with or without COVID vaccination, than it is actually in the COVID vaccine population. There are about 30% incidence of thrombotic or blood clot complications in ICU patients with COVID-19, despite putting them on blood clotting prevention medications. These include things like heparin, aspirin, and so forth. Despite putting these patients on all of those blood thinners, so to speak, about 30% of COVID patients in an ICU will develop blood clots. So that is due to the COVID infection. These are not vaccinated people. These are persons who just have COVID. And 80% of all thrombotic complications or clotting complications, and the most commonly observed in the COVID-19 patient, is the pulmonary embolism phenomena. So that's an important thing. So in terms of people who would have developed clots across Europe, they would have vaccinated in the early days about 17 million people. 17 million people received the AstraZeneca vaccine. And of those 17 million persons, there were 37 cases of blood clots. 37, and I believe 22 persons would have died. Much, much less than what occurs in the general population. So it is important for us to understand what are some of the warning signs if you have a blood clot. So it's one thing to talk about it, but it's part of my job and my desire to make sure that people understand if you do have a blood clot what are the things that can warn you about it? So if you have a blood clot in the legs, for example, there can be pain or swelling in your legs. That blood clot can sometimes break off from the leg, travel up the veins, and enter into the lungs. When they enter into the lungs, it can cause chest pain and shortness of breath. These are usually something that occur suddenly, like quickly, without any warning. You can just develop that. Sometimes blood clots can also break off and end up in the brain, and it can cause stroke. And this stroke, one of the earliest or most recognizable feature of stroke is sudden difficulty moving one side of the body, one side of the face. It's either weak or completely not controlled, so that you can't move it. It becomes weak, it becomes limp, it becomes flaccid. And the other warning or feature of a clot in the brain that can cause a stroke is sudden difficulty speaking, when people are slurring their words, the tongue not moving to form the words and pronounce the words the way that it should. So these are all warning signs of blood clots being in places that can cause trouble. Blood clots in general can form in the lungs, they can form in the legs, and when they form in various places, not only do they cause problems at that area, but they can actually break off and go to other places. And when they move to the brain, it can cause stroke. When they move to the lungs, it can cause parts of the lungs to die. And when that happens in the lungs, it puts extra strain on the right side of the heart, and then that can cause its own complications with the heart. Unfortunately, when blood clots go to some places, lungs, brain, etc., the ultimate bad outcome can result from that, and that is death. And as we have discussed before, about 150,000 to 200,000 persons die per year in the US from blood clots going to the lungs. So it's an important thing to recognize, and that is why so much attention has been paid to it, and any links to any vaccines are being explored. There's nothing wrong with trying to find out the information if there is a link, because it is an important question to answer. Because if all of a sudden we find people dropping dead or developing massive blood clots in large numbers, we would have to revise our approaches to vaccines or any particular vaccine. So far, there is no evidence or no overwhelming or convincing evidence to suggest that there is more blood clots or more serious side effects using any of these vaccines, and particularly the AstraZeneca vaccine, than in the general population or persons who have underlying clotting problems. So even COVID-19 by itself can cause blood clots. And that is why one of the things we do for patients admitted to the hospital with COVID-19, especially if they're in the ICU, we put them on blood thinners. That is part of their treatment, because once the blood clot forms somewhere, it can break off and go to bad places like the lungs and the brain, cause pulmonary embolism, heart failure, right-sided heart failure, or cause stroke, and people can actually die from those complications. And that is why COVID-19 patients admitted to hospital will be put on blood thinners in order to help them prevent clots from forming. So 70% of all blood clots are associated with known risk factors. And what are some of the risk factors for blood clots? Things like being immobile or not moving about, being on a long flight, persons who have connective tissue disease, persons who are on certain medications, people who have cancer. These are all things that can put persons at increased risk for developing blood clots. So I hope this would have shed some light on the issue of blood clots and our vaccination program, etc. And maybe it would have encouraged you to feel a little bit more assured and feel less uncertain about taking your COVID-19 vaccine. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.